Okay, I think we're ready to get started. Good afternoon, everyone. My name is Kristen Delkamp, and I am today's moderator. Welcome to our sixth session in the Coordinated Entry Cohort series, this time focusing on evaluation. This session is brought to you by the State of California's CARES Act Coronavirus Relief Funding. As a reminder, this session is being recorded for the public record. The slides and video recording will be sent out to all registered participants within 1 week of today's session. And now, without further ado, I'd like to introduce our presenters, Jean Field and Mindy Mitchell from Homebase. Take it away.
Hey, everybody. Welcome, welcome, welcome. I see a few more people have popped in. Good to see you all. And let's go ahead and get started. This is our final session together, so I don't want to keep you any longer than we have to. As Kristen said, slides and recordings will go out to you all. What we wanted to start with today was, like usual, if you guys could pop in the chat who you are, the organization or COC that you're with, what your role is in relation to the coordinated entry system, and your response that's relevant to today's session, which is about evaluating and improving your coordinated entry system. So tell us about where your community is right now in its coordinated entry system evaluation and improvement process. Hey, Tuesday, welcome. We had a couple more folks join. Again, if people could just put their name, their organization, COC they're with, rolling coordinated entry system, and where you are in your coordinated entry systems evaluation process. Hey, Damaris, welcome. Okay, I'm going to go ahead and move us along. However, keep the chat going. Let us know and let your fellow attendees know who you are, organization that you're with, and give us a little insight into where you guys are in your coordinated entry system evaluation process, because that's what we're going to be talking about today. And as we have discussed before, this process is a required one. So it's something that your COC can and should be doing on the regular, just to make sure that things are going well and to keep improving things. Hey, Melanie, welcome. And today, that's what we're going to talk about. So Jean is going to cover kind of the continuous evaluation and improvement process. And then I'm going to speak a little bit about like what that actually looks like, the actual people who are going to be doing this in your community, the process that you will go through to make that happen, the working group and things like that. And then we'll close it out with a discussion and an announcement for moving forward with cohort 2, because this is our final session of cohort 1. As you guys know, this was the starter for the conversation about coordinated entry that we were so happy to have HCD sponsor, so that we can kind of build out this foundational content for what can be, for some folks, especially if you're just getting started in the homelessness system, a confusing process. So we met every week. Thanks so much to those of you regulars who showed up every week and for taking out some time. It's been mostly me and Jean and occasionally Christiana from ICF, but always, 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 and so thankfully for Pickles, the coordinated entry cat. As a reminder, you'll see her here and there throughout when there's a topic that you need to pay special attention to. Like this one, HUD's definition of coordinated entry. We do start every session just touching base back to this kind of overview of what coordinated entry is, with the emphasis on the centralized and coordinated process. As you know, you're doing an intake assessment, you're prioritizing folks so that you can provide referrals to housing programs. As we've discussed over the course of this foundational series, you want to really think about the geographic coverage of your coordinated entry system, and that's a matter of equity too. Are there parts of our community, of our COC, that we're not reaching? We want to make sure that we reach them all, that it's easily accessible by people who are seeking housing and services, especially folks who may have traditional barriers to accessing services. So you're well advertising, and then you're developing that assessment tool. And that's something that we'll talk about a lot more in the second part of our cohort. Okay, next up, Jean is going to cover some material that talks about the continuous evaluation and improvement process for coordinated entry. And Jean, I'll go ahead and start the slides.
Thanks, Mindy, and welcome everybody. And thanks for coming and keeping in time with us as we did a big overview of the coordinated entry system. And I want to make sure that you understand that this is still an overview, but we have 2 sessions where we're really going to take a very deep dive into the area we're going to talk about today, which is assessment and prioritization. But I want to maybe step back and really give some guiding principles that we have learned from the communities in which we've worked and who we've talked to about their system. And I would say one of the things that's not here on the screen, a foundational principle of coordinated entry, is that coordinated entry is a system, and it's a system that uses processes that should not and cannot remain static, because the people in your community and the resources in your community do not remain static. Those are always changing, and we always want to do better to serve those people. And as we talked about last week, those housing pathways, the whole goal of the system is to get people into housing. And it takes a community and a lot of different pathways to do that. So that's really what we mean by this continuous evaluation and improvement. And one of the things that we talk about is at the most communities and are required is to do an evaluation of your coordinated entry system. But all too often, those sit on the shelf. They're at the end of a process, and really they also are at the beginning. What is it about your system that needs improving? So here are some of the foundational principles that we think communities should look at when they're talking about making change and assessing their systems. Number 1, simplify it. Simplify your assessment, simplify your prioritization. Now, I realize, especially in some big, sophisticated community COCs, that that's not as easy as it sounds. You're serving a lot of people with a lot of different resources, with a lot of different priorities, and sometimes that gets complex. But if you can't explain it, your community can't understand it, and then you can't make sure that it's working if you really don't know what it's doing. So one of the things that we also say in regards to simplifying is down in the corner with Pickles. Pickles is pointing out one of the more important thing is increase the transparency of the process, because that helps the community understand it. It helps them buy into what is sometimes a very contentious system, and it helps them identify and serve priority communities and better house people. That is really the goal. And if you don't understand what the system is doing, or if it's shrouded behind a lot of non-transparent numbers and formulas and processes, then it's going to be hard to change it for the better. And I've worked in a lot of communities where there was mistrust of the system because there wasn't a lot of transparency in the process. So I just want to start and end with Pickles on that. Some of the other principles is that a lot of communities are focusing in on those assessment tools and those prioritization strategies. And that's fantastic. But before you do that, really explicitly look at who's being served and who's being left out. And that includes, but is not limited to, are you looking at equity? Are you looking at equity of who's being served? Are you looking at the equitable aspects of who's not being served? And are you looking at the systemic racism that has affected the people you're serving and affecting their housing outcomes? So be sure to center equity throughout this process and understand that taking a look at holistically and specifically at the process to address equity is really important. A lot of communities have a lot of dissatisfaction about their assessment tool. Understood, empathize, agree, all of those things. But focusing on that assessment tool while you're not looking at the entire system is not a winning prospect. But when you start drilling down on your assessment tool, don't just think that you can go to, Best Buy and buy another one off the shelf, or you can go to the next door community and say, hey, let's do what they're doing. There are off the shelf tools that are being developed, but they still need to reflect local priorities. Who do you want to serve? And tested on local priorities. Are you actually serving those people, right? And really looking at those tools to make sure that you're gathering only enough information required to prioritize people for the housing resources that you have and that you can serve them with, right? A lot of communities really are conflating their assessment tools with their overall case management tools. So assessment for prioritization is one tool. Assessment for needs, or what can we do to be better serving them, that's maybe an add-on. You can do a little of both, but really focusing on what you're looking for. The next slide. And I covered this, is really trying to identify very specifically the areas for change in your community. So once you've decided, okay, we are not serving enough Black people in our permanent housing solutions relative to their scores on our assessment tool, relative to their prevalence in our communities experiencing homelessness, whatever those measures are, what specific changes to prioritization are needed? Or we are not serving enough folks who have severe medical conditions. They're somehow not scoring high enough on our assessment tool, even though we know they are incredibly vulnerable. What specific changes to our assessment questions are needed to capture that information so that we know who is very vulnerable and at risk of dying, to put it very, very clearly, right? Do you need to change the information you collect from people? Do you need more? Do you need less? Do you need different things? What goals do you expect to accomplish through change, and how do they fit within HUD regulations? I'm surprised we don't have a picture of pickles there. Looking at HUD regulations, but also your community priorities and the housing available to people, right? Many times we recommend that if you are starting to get a different kind of housing that has different eligibility or priorities, take a look at your assessment tool. Are you able to find those people through the information that you're collecting? Okay. Could an off-the-shelf assessment tool meet your community's unique needs? And how do you figure that out? Do you test it? Do you go and look at who's being served in other communities? Do you talk to your communities about who's being served? Yes, yes, and yes. Do all of those things. And again, how will you incorporate equity into your system? And some of these questions can be answered by data, maybe looking at your systems and the data of who's being served. Some of those really require a more person-centered approach and going out into communities, talking to the experience of evaluators who are using your assessment tools, talking to people who have been evaluated or not evaluated. What is their experience with these tools, right? And also talking to your programs. What is their understanding of how the assessment tool helps them prioritize people for their programs? Next slide. Thanks, Minnie. So for those of you who have determined that we really need to change our assessment tool, we really need to collect different data in order to meet our community prioritizations goals, there are 4 approaches that we have seen communities take. And again, we're going to go in a deeper dive in this in the next 2 weeks. And but really, I like to put them in some buckets: augment and don't replace. A number of communities have decided that we really don't like the VI SPDAT. It wasn't made for collecting this kind of data. It asks too many questions and equates the value of all of those questions. But we do feel that we've really has a good assessment program. We're really reaching a lot of people, but we want to change how the questions on the VI SPDAT are scored so that we more heavily weight, for example, medical need. That's one that many communities have done. Or other communities will more heavily weight length of time homeless. That's something that you can do within the parameters of most existing tools. You can just more heavily weight some of those questions, and then you test and say, who would we be prioritizing differently? Meaning, who would be getting those housing and services first? The next way that communities do it would be what is called an administrative data test. And that's a little bit deceptive because it's not administrative. It's really it's data about people, but it's coming from other administrative systems. And I will say that there are a few models that have done this successfully, but it is not the most obvious choice for communities that don't have incredibly robust data sharing programs with places like medical systems, hospitals, law enforcement, other sources of data. And the benefits of administrative data is it's not self-reported, right? You can find that. It's not intrusive. You're not asking people very intrusive questions. But the downside of it is not always readily available. But it is something that communities are trying. Off the shelf. I talked about this a little bit, but really what they're taking is they're taking what other communities have done, and they're saying, okay, we're going to try it out in our community. And there have been some successes with that, and we're going to give you a few examples, and we'll go into this deeper in the next 2 weeks. But in every case with an off-the-shelf questions, it's like the VI SPDAT. You have to test it and make sure that it works for your people in your community, your demographics of your community. So for example, we know in many California communities, the equity concerns center not so much about race, but about language access. That's one thing that we found in a lot of those communities. So is this off-the-shelf tool accurately capturing the needs of people whose English is not their first language or have cultural differences, right? That is a barrier for them for accessing services. Other barriers include just representation in different kinds of housing programs. So every off-the-shelf toolkit needs to be tested in local scenarios. Also, different kinds of housing resources. We don't want to spend a lot of time on an assessment tool that will prioritize many people, for a very scarce resource, because then people are just sitting on the list. So again, really a lot of help. You don't have to make it up yourself, but it still needs to be tested in the community. And the keep it simple approach. We call it the keep it simple approach because a number of communities have really spent a lot of time looking at who they want to prioritize for their housing resources that are in coordinated entry. They look at specifically the vulnerabilities of those people. What is it about them? Is it because they're very ill? Is it some of the effects of chronicity of homelessness that we're really looking at? And they may ask 4 or 5 questions of the people that they're assessing and use the answers to those 5 questions as how they are prioritized for housing resources. And again, some communities started off with that, found that they were introducing some inequities into the system and revamped. So just as an aside, none of these are really simple, but they are different approaches depending on the needs of your community. Next slide. And so the lessons from other communities really come down to things like lead with prioritization. The assessment tool is a tool. It's not the be all and end all, right? It's a tool for prioritizing the people for scarce housing resources and some of those services. Community input, data analysis, and available resources are crucial to establishing priority populations. We really need to talk about who's most in need in our community this year. Less is more. Don't assume complex is better. If you can't explain it, it may not be a fit for your community. Time after time, I've gone into communities. I've tried to figure out their coordinated assessment prioritization. It's taken quite a lot of digging through their website, through back minutes of many coordinated entry committees. And when I go to my first coordinated entry meeting or my meeting of housing providers, there were so many misperceptions and wrong perceptions, including mine, of how prioritization worked, that there was no wonder people couldn't come together and talk about what was happening in the system. So make it simple so you can really make sure people are understanding how it works. And also in those simple factors, you can change one thing and see how that changes the result. When there's a very complex system and you change one thing, that maybe changes two other things, and you don't know exactly what is the precipitating factor of changing the results. Testing and planning for change. Assessment and prioritization should be able to change with the addition of new resources or community dynamics. Some great examples of that happened in every community. Think of your COVID policies. Many communities had temporary policies that prioritized people who matched the CDC vulnerability factors for COVID, right? We wanted to get them not only into shelter, but we wanted to get them housed because they were very vulnerable in congregate settings or on the street, right? And that worked well for a lot of communities, and a lot of communities took those learnings and put them into place for more permanent session. It's always also assessment and priorities should change as we better understand equity and in our populations. When we start looking at the data and we see who's being left out of housing because of housing discrimination. So maybe you have your providing vouchers to a certain community, but because of discriminatory factors in the community, they are not getting units. What do we need to change about that, right? Is that another service they need? Is that a different kind of housing? Let's talk about that. And simple prioritization schemes and assessment teams just are a lot easier to make changes. And no matter what system you choose, you will need to make changes. That's a guarantee. But it can be a really great process because in the meantime, you're going to keep housing people. And that's what it's all about. So I promised a couple of examples, and I will give you those examples as soon as I click on my notes. Hennepin County, Minnesota, often cited for some great best practices. And they really did some evaluation that showed that referrals using the VI SPDAT were inequitable. More white people were being referred to PSH, more Black people were being referred to rapid rehousing, which, as we know, is not a permanent housing and can be often difficult to maintain. So the COC implemented some new processes, and they prioritized based on disability, chronic homelessness, length of time homelessness, and then they started adding a few more processes that ended up in more equitable housing distribution and prioritization. Fantastic. However, there were still some inequities among their indigenous communities that they were seeing. And other communities tried to do the same thing and resulted in less equitable outcomes. So again, great models for how to do it, but not necessarily just taking the tool off. Maricopa also did, I think they started out with 4 vulnerability factors: risk of remaining homelessness, health conditions, high utilizers of homelessness response system, and addressing racial ethnic disparities. And I think they fine-tuned each of those, but those were their 4 buckets of questions that they used. Austin, Texas, on the other hand, developed 9 questions that they found through data research that Black and Hispanic Latinx people answered more frequently than white people. And so they started with those questions thinking, what about those are indicating vulnerability for that group? And so then they started there, and then they took some other kinds of vulnerability questions that they felt would add to the equity of the pool and more accurately reflect the vulnerability of the people they were assessing. And Chicago, I don't know if their pilot is concluded, but last time I looked it up, they were piloting a six question assessment to replace the VI SPDAT because their work groups just felt the VI SPDAT was too long and too invasive and didn't give them the results that they wanted. So that was a brief summation of what some communities are doing. And I know that there are more California examples because I know many of you on the call either are in the process of revamping yours or want to be. So that's what we're here for, is to really talk about that and help move those processes along. Back to you, Mindy.
Jean, and I really appreciate you bringing up over and over again the importance about tailoring this to your community, testing this in your community. As we talked about early on, it's so easy to both do two things, to just use this tool because it's there, or to reject this tool because it showed something in some community that had disparate outcomes. But as you guys will remember, early on, when we looked at outcomes from specifically VI SPDAT, but it could be with any tool, there were some communities that had disparities one way, but then other communities used the same tool and had disparities another way. And then other communities used the same tool and didn't have disparities at all. And so just always keep in mind, it's not necessarily the tool, it's how you use it. It's where you use it. It's who's using it, right? And who's giving the tool and who's taking the tool. There's just all of those very kind of hyper local considerations around all of this stuff. So that's why you all have to come together as a community during this evaluation process and think about what makes sense for your COC. And that's what I'll talk about a little bit on this. It's just that you're moving forward now. Okay, we've covered all of these kind of basic things. We're doing evaluation and improvement regularly because Frankenpickles says we're required to. And what does that look like? What's that process? Not surprisingly, it's a very community focused process, right? So you want to have a working group whose focus is the CES assessment and prioritization, redesign. Maybe you don't go all the way to redesign and it's just a tweaking here and there, right? But there should be a working group who this is what they are focusing on. Those members of that working group should be nominated by various community partners groups. And then the Coordinated Entry Advisory Committee of your COC would be the one who approves those nominations. That group is the one who really looks at all of the things that Jean talked about and makes all of those considerations, kind of asks all those questions and thinks about what our priorities are, right? Looks at the data, as much data as you can get. Talks to people with lived experience about what their experience was of the coordinated entry process so far, that customer service focus, right? Like really understanding, is this really invasive? Am I asking questions that have nothing to do with actually getting into COC or ESG housing, right? Like all of that kind of stuff will inform the work of this working group. The working group then brings its recommendations to the advisory committee. And then there is that community-led process. The community is led by the committee itself. And when Jean is talking about, for example, when Homebase or other TA providers, when we're going into communities and we're helping them with coordinated entry redesign, that's what we're doing, right? Like we're helping with that community-led process. So this is what it looks like, right? It's very starting out at the very basis of it from the community. And the working group itself has these goals, right? You're leading and engaging in the work, not just reacting and providing feedback. It's really hard, especially with an issue that can often be a political football, like homelessness. It's really hard to get out of reaction mode. But here's the thing, when you all come together as a community, you make this part of your process. You understand that this is an ongoing thing, that it's not static, like Jean said in the beginning. Then it's not about reacting because you're always thinking about it. You're always trying new stuff. And it's part of what you're doing, and you're able to talk about it in a way that's not just reacting to things that might bubble up. The working group is also identifying and proposing the different implementation strategies that has come up in the research that and the talking and the interviewing that they're doing, to think about, do we need some new assessment and prioritization tools? Do we need to just augment? Do we need to do something off the shelf? Do we need to get better administrative data? All of that kind of stuff. The working group is also going to be the kind of group of folks that will be presenting those proposals to all the different folks in the community, and also for the COC, various programs, nonprofits, your government, your local government leaders, right, and their committees. It's also going to be referring back to the Coordinated Entry Advisory Committee with the progress that it's made. This working group is also the liaison to the stakeholder groups that have nominated them, or that they're aligned with. And this makes sure that you have that constant feedback loop, and that the community still feels like it's a part of this process. Another thing that Jean talked about that has happened in some communities is that people feel very disconnected. It's a mystery what happens in coordinated entry. I know, you will hear people with lived experience say, well, I filled that thing out and I never heard back from anybody. I don't know where I am on the waiting list. I don't, making sure that you're being transparent. This is part of what helps you maintain that transparency and keep that community buy-in. The working group is also making sure that the work that it's doing is aligned with and not duplicative of other work that is happening among all the different committees and the working groups in the COC. And again, like when you're thinking about with your tool, with your prioritization process, you're also asking these questions about the makeup of your work group. So you want to make sure that you have inclusive representation of the providers that are going to be part of your coordinated entry system. This means thinking about diverse program types, the geography, and remember, it's required that you have that full geographic coverage. So thinking about that when you're thinking about your work group too, thinking about the folks that you're serving and where they are in your COC, that's all part of thinking about what inclusivity looks like. You also want to make sure that at the person level that you have a diverse group of folks, including people with different lived experiences of homelessness from different racial, ethnic, cultural backgrounds. All of that is also a part of what you're doing when you want to make sure that you have a working group that is able to bring all those different perspectives, because somebody might have, based on the various social categories that they have lived in their lives, and if they've experienced homelessness in those social categories, an insight into things like coverage, into things like what feels invasive or not invasive, into things that's like, this is actually a vulnerability factor. That just helps your work group do better work. Especially in California, thinking about and making sure that your work group has representative of your local tribal nation or nations. I know a lot of COCs have many nations actually within their COC boundaries. So that's a really important separate factor in thinking about what your work group looks like. We also know that Native Americans are overrepresented among people experiencing homelessness, but also very unlikely to get access to COC and ESG services. So having someone from tribal nations as a part of thinking about how to make sure that we serve those folks is going to be really important. You want to make sure that you think about, for equity purposes, who are the advocates for people of color in your community? Is there someone from those groups who can also be a part of your work group? And here's a special hint, maybe those folks can also, because they're probably doing some kind of social services, maybe eventually down the road, this is also a way that you diversify your provider pool in your COC. Just a little hint about that. And also the work group should be focusing on targeting the number of members to make sure that you maximize effectiveness, right? So we have all experienced this, and this is always this kind of like balancing act that you have to do with wanting to ensure that you have diverse representation and perspectives and experiences, but you cannot have every single person in your community be a part of this little working group, or else it will never get anything done, because your 2-hour Zoom meeting will just be filled with people doing introductions. And we have all been on those 2-hour Zoom meetings. And we don't want to do that. So just think about those things, understand how to balance that out. And that can even be part of that priority conversation, right? And thinking about who is it most important to have on our work group? What are the kinds of perspectives and experiences, geographic coverage, social service experience that we want to have informing this process, because this process is going to directly affect how we interact with people experiencing homelessness. And that is it, you guys. We are done with our part of the cohort and this presentation. Want to open it up to you all one final time for question and answer, just discussion. Anyone want to share, now that we're kind of through the process, about where you are in your community on evaluating your coordinated entry system? Any insights that you have had in that process? Would love to hear from you all. You can unmute or pop it in the chat. And if no one has anything to add, any questions, Jean and I just covered every single thing, and it all makes perfect sense now. I love when we do that. We will go ahead and move on, because there is some important information. First, obviously, let us know if you do have any questions. You can always follow up with us by email. However, here's the really exciting part. The rest of the sessions for this month of March will be the cohort 2 sessions. So as you guys will remember, for cohort 1, we're kind of laying the foundation, fundamentals, very kind of 101. But cohort 2 will be designed for those who already have some experience and exposure to their coordinated entry systems in their COC, may even be at the administrator level, and want to improve your knowledge around specifically assessment and prioritization. And this is all with the goal of this continuous evaluation and improvement process to help your COC improve its own assessment and prioritization processes. So these 2 sessions, starting at same time, but a little bit longer, they're going to go for an hour and a half. So from 2 to 3:30 Pacific on Tuesday the 19th and Tuesday the 26th. Now, this will be a separate registration, and Kristen has put that into the chat, so you guys can click that link and register for these 2 sessions. We know for sure Jean will be on. I may be on, but you'll also get to meet 2 new home-based colleagues, Matt Olson and Emma Beers, and they're really, really savvy about specifically these 2 things, and will be able to lead you guys in a much deeper dive about assessment and prioritization. And that's it for me. Thanks so much, you guys. It's been great hanging out with you for 6 weeks now.
Put my thing down there. I will say that I have had the honor of sitting in on a planning session for the cohort 2 group, and this is going to be really an excellent way for people to dig in and really get an idea of what is working for their agencies and what maybe needs some tweaking. So I'll just end it by saying thank you, Jean and Mindy, and on behalf of ICF and California HCD, thanks to all of you for joining us for the first cohort series. We'll see you next week for the kickoff for CES cohort 2. And as Mindy said, that is going to be going from 2 until 3:30, focusing on prioritization and assessment. Keep in mind that that cohort 2 has fewer sessions, and they are longer at that 90-minute length. In the meantime, be on the lookout for the slides and recordings from today's sessions and arriving in your inbox soon. And everyone have a great day today. Thank you.
Bye, everybody. Thank you.